Good morning, everybody. It's truly an honor to be back and to have a few minutes to share with you about some thoughts. I want to thank Hillary for her description. I look at probably 400 to 500 charts a year that describe mesothelioma victims, and what I always remember is what Dr. Solikoff used to say, is that epidemiology is sadness with the tears wiped away, and to put a real live face and story together is important. So her last comment was that we hope to get rid of asbestos in this country. There are other countries in the world, as you'll see, that this has taken place. So clearly we all know that asbestos has been well studied in the developing world with good understanding of the risks of disease. Less so has there been work in developing countries. Now we all know that it doesn't matter where you live, that people everywhere in the world are going to get disease. Nevertheless, it is only relatively recently that the science in some of these developing countries is catching up. So while we have more than 55 nations, I think I saw a list yesterday, it's either 58 or 59, have totally banned the use of asbestos, we are still, in this sense, a developing country here in America where it is still a legal product. Many of us find that hard to fathom, but at least our colleagues around the world seem to have done better than we have with regard to this. And so clearly the fight against asbestos is now a worldwide issue. So what I'd like to share with you in the few minutes that I have is just some of the examples of what's going on around the world. There are some true horror stories. I've started with one of them that I'll share with you in a minute, but also some successes as well, trying to overcome the situations in some countries where asbestos has not yet been banned. I have been to almost all of these countries, I guess every place but Russia on this list, and have done work in each one of these countries. So I have some experience with what goes on there. India is a horrible example of a country that still uses an enormous amount of asbestos. It uses about 1/4 of the world's asbestos at this point. They have an organization similar to our NIOSH. It's their National Institute for Occupational Health. A number of years ago, they had a study carried out on asbestos-exposed populations or group of workers. The study was put together by the industry. It was paid for by the industry. It was reviewed by the industry, and then came out as a report saying, you see, there's no real problem here in India. This agency is also supposed to record mesothelioma deaths. They have never recorded, to my knowledge, a single mesothelioma death in India, yet I know at one hospital alone in Mumbai, in 1 year alone, they took care of 32 patients with mesothelioma. Obviously, the recording system isn't very good. The NIOH report was truly a travesty, and they send to, in the past, and probably will do so again at the upcoming Rotterdam Convention meeting, they will send the spokesperson for the asbestos cement industry who will give instructions how to vote, not the government ministers. So this is a country that is desperately fighting to try to ban asbestos. We've worked with some folks over there. An 11-page letter just went out prior to the upcoming conference to work on this. Sri Lanka, that little island nation off the southern tip of India, is another country where they use asbestos. They have had some efforts to try and ban it, but they've never had any data. So working with the former head of their NIOSH, he unfortunately passed away, but his daughter-in-law, who's also a public health physician, has worked with me, and we now have the first data collected from the country of Sri Lanka, which I'm hoping to present at a scientific conference later this year. An interesting outcome of that work was that it was demolition workers and workers who cleaned up after the tsunami of 2004 that seemed to have the highest rate of disease. So it isn't just working with it, making products and putting it in. it's also the materials coming out. Mongolia is an interesting case study. They banned it, then they reversed partially the ban on asbestos. We've published again on the first case of mesothelioma that was truly and accurately documented in that country. We have a paper under review right now about the uses of asbestos. We have a situation there where companies want to continue to use it for illegal purposes. They ship it in bags labeled things like sugar, and then they make use of it. So there's actually more use going on than the official import figures will show. China, which is also a major user of asbestos, has modified its use. They are starting to build certain products like automobiles to be asbestos-free, in part because they want to export their vehicles around the world. But they still use a significant amount of asbestos cement, but have recognized that this material is hazardous. I know we'll be hearing from Fernanda later today, and she can fill you in even more on the situation in Brazil, but there appears to be advances. I was talking with her last night that a number of the states in Brazil now have had a ban, some full, some partial, but there is continuing efforts in Brazil to restrict on its way, hopefully, to eliminating the use of asbestos. One of the situations that concerns us a great deal is the study that IARC, the International Agency for Research on Cancer, undertook with Russians looking at the town of Asbest. That's the major production site. About 2 million tons a year of asbestos come out of this community. Truly a travesty. There is no question over the years that the asbestos, which is chrysotile, will cause problems. There's data from the past. Now they claim they have no problems. And Argentina and Colombia are countries that we've just started doing some work with. In Colombia, we've undertaken a study of some factory workers, and they're starting to create data in countries where this doesn't exist. So the fight is still there. We're still fighting. We must fight harder. Fortunately, there's a lot of people around the world willing to do that. So thank you very much.